Good morning. My name is Jackie Klotz, and I want to welcome you to our virtual panel today, moderated by Rachel Koay from Feeding Texas. Through this insightful conversation, we will hear experiences from the Central Texas Food Bank, East Texas Food Bank, and Houston Food Bank as they navigate the rapidly growing trend of food as medicine programs in Texas. They will share best practices for healthcare organizations in approaching strategic partnerships with local food banks to leverage food and nutrition resources that improve patient health outcomes. We are glad everyone has joined us today to be a part of this illuminating discussion, and I want to invite everyone to introduce yourself in the chat, mentioning any work you do with your local food bank or in food as medicine movement more broadly. To tell us more, I'm going to pass things over to our consortium director, Dr. Charles Mathias.
Thank you, Jackie. Welcome, everybody. I'm glad you made it here today. We're excited about this webinar. We've been getting a lot of questions about this topic, and I think the timing is great on the follow-on from our most recent discussion about food programs. Just as a reminder, these sessions are recorded, and we'll send out a link with our YouTube channel so you can watch this again after the session, and we'll include a PDF of any slides that we have. There will be time for question and answer after the session. I'll be monitoring the chat, so drop those in as you think of them. And when we get to the Q&A session, I'll call on folks to unmute and pose whatever questions that they have. Today's panel, we're grateful to have moderated by Rachel Koay, the Chief Equity and Impact Officer at Feeding Texas. As a public health dietitian, Rachel oversees the impact of programs and strategies that tackle hunger across multiple fronts, and she is passionate about making health easier for all by addressing the root causes of hunger and illness. Her expertise comes from working with community organizations to improve health among refugees, people experiencing hunger, and children from underinvested communities. Please join me in welcoming Rachel, who will tell us about the work of Feeding Texas is doing and also help moderate our panel discussion, which is called Partnering for Health, Strategies to Establish Local Food Bank Partnerships. Rachel.
Thanks, Charles. And I'll add, a lot of my education comes from being mentored by food bankers, many of which are on the panel today. And so I want to thank y'all, the consortium, for allowing us some time to share and to spotlight the great work that food banks do. And I always feel so proud to be associated with our great network. So I'm going to walk through just 3 level setting slides to tee up the conversation, and then I'll have our 3 wonderful, intelligent, experienced panelists share a little bit about themselves and the work that they do. So let me share my screen. One of the beautiful things about Texas food banks is that we are a really strong network. We like to brag that we're probably one of maybe the strongest state association of food banks in the nation. We have 20 member food banks that cover all 254 counties with services, with food, with partnerships that get food and resources to Texans facing food insecurity. And you'll hear from some of the food banks that are leading a lot of this work in the healthcare partnership space. And I think one thing I want to mention is that this network does a lot together. Food banks do disaster relief together, as I think about even the recent disasters in the Houston and Gulf Coast area. We do a lot of advocacy and communication together. And then on the program side, as we think about healthcare partnerships, I want to mention that all of our food banks do SNAP application assistance under one common strategy together. And so as we think about work in this healthcare partnership space, we are working hard as a network to think about ways to come together and scale best practices and move in a united front to make it easier for healthcare partners like yourselves, for MCOs, to plug in to the way in which food banks serve our communities. One thing that I like to tee up our conversation about food banks generally is like, how does food banking generally work, and what's the difference between a food bank and a food pantry? Many of you may have visited your local food bank and understand that operations is a beast of food and warehousing and staff and food sourcing. And so I love this visual from the Central Texas Food Bank, where it just talks about how food banks gather all of these partnerships and resources from a number of different entities, and then through a network of over 3,000 partners across Texas are able to distribute food and programs and social services to communities facing food insecurity. And so I wanted, again, food banks operate at a very massive scale and have been able to move high volume for a very long time to Texans in need. And then as a dietitian, I love touting this fact that food banks have been committed for a long time to increase produce distribution to the community. Over my time at Feeding Texas, I've really seen food banks build and embrace and build capacity for nourishing their communities. And so over the last 5 years, especially, food banks have done a lot, both from a storage to relationship building to amplify the amount of produce that they bring out into their communities. So, prior to my time working with food banks, I did not know that almost half of what food banks distribute in Texas is produce. And I think that's a really important truth that allows food banks to be very credible partners when we think about how do we improve community health. And so with that, I'll turn to our 3 panelists. And would love each of you, starting with Kim, to share a little bit about yourself and share a little bit about the breadth of work that your food bank is doing related to healthcare partnerships.
Sure. I am Kim Morris. I'm the Chief Impact Officer for the East Texas Food Bank. Really appreciate the opportunity to be here. What's really cool about the work that a lot of the food banks do is that it is so diverse when it comes to working with our medical partners in the community. And so in East Texas, we have a Partners in Health program, which was created in 2017 or 2018. And we've done a lot of work there, crafting and learning and growing on how we marry food distribution with understanding healthcare needs. But then we also have partnerships where at some of our resource centers, we have medical checks that hospital partners will come in and offer to our neighbors in need. We have mobile units that will join our mobile food distributions out in the community to offer services to those that are coming there. We do produce distributions at clinics in some places, and then we have some relationships with FQHCs throughout our service areas, particularly where our resource centers are. So in Lufkin, Longview, Tyler, and Texarkana, our territory spreads about 20,000 square miles in 26 counties. So we're pretty widespread and highly rural in our area.
Thanks, Kim. And then Bella, I'd like to go to you. Share a little bit about yourself and the work that Central Texas Food Bank is doing.
Yeah, my name is Bella Kircher. I'm the Director of Health and Wellness here at Central Texas Food Bank. And my background is actually mostly in healthcare. So worked in community health for a long time at FQHCs, community health, worked in private healthcare, and then before coming here, worked at a social care referral platform. company. And so have kind of seen lots of different sides. And so now I'm thrilled to be working with my team here. And so we are involved in healthcare in a number of different ways. One, we have a nutrition education team that goes out to some of our healthcare partners and actually offers free education to those partners. We also have what we call our mobile food pharmacy, FARM, and that is a 10-foot trailer that has food that's been vetted by a registered dietitian here. It includes shelf-stable food, produce, including produce from our organic garden, as well as frozen proteins, dairy. And so we actually have partnerships with FQHCs, community health centers, and some other organizations across our service area. And we show up there. And this is actually one of my favorite partnerships because we work really closely with their community health workers. So they know their patient population really well. We know food really well. And so that's been a really great opportunity to allow people to have a really dignified experience of coming on board, able to shop with a little grocery cart and get groceries that their provider has told them they need to get. We also have an on-site pantry, and we're interested in expanding, working with clinics and hospitals in the area. So we've been in conversation talking with those folks. And then we also have a very large home delivery program. So we serve about close to 2,800 folks in the community, dropping off delivery. Currently it's shelf stable, but we're moving to also provide produce. And so again, our registered dietitian helps look at all the foods that we offer. So yeah, just really excited to see where this space is going to go. I think we're also looking into medically tailored meals and medically tailored groceries. And so but yeah, we have a 21 county service area. We're located in Austin, headquartered in Austin, which is pretty urban. Waco's in our service area, but then we have lots of rural counties as well that we cover.
Thanks, Bella. Nicole, I know lots of people know the Houston Food Bank, but tell us a little bit about who you are and what y'all do.
Hi, everyone. Nicole Lander, Chief Impact Officer for Houston Food Bank, and health strategy and our programs are one of the areas that my teams oversee. And, you know, we are not unique than the other food banks that have spoken. We cover the smallest counties. We have 18 counties, and we partner with 3 other smaller food banks to serve those counties. The Houston Food Bank partners with Galveston, Brazos Valley Food Bank, and Montgomery County Food Bank. So those might be community food banks that you are familiar with in your areas, to distribute around 165 million nutritious meals a year. We do that through a network of 1,600 community partners that include healthcare entities and health plans. Today, we'll focus on our health equity strategy, which really encompasses a medically tailored meal program, medically tailored groceries that we call Food RX. Our first link program, which is really linking people managing chronic conditions from their healthcare provider to state benefit resources, as Rachel and Kim mentioned earlier, that we have within our network, and then of course our nutrition education. And so we really think of our work in maybe 3 major buckets. You know, what's that adaptive change that we can have the impact on the household? What's our role in advocacy to make sure health policy advance forward? And then what's the programmatic approach through those 4 programs that I talked about a minute ago?
That's awesome. I love that frame around equity and got the 3-pronged approach. It's holistic, and I know as a network, we're also moving in that direction, like really thinking together about those solutions in those ways. I know a lot of people on the webinar are either doing something related to social determinants or non-medical drivers of health, or are really interested in partnering with food banks to think about food insecurity. And so Bella and then Kim, I'd love for y'all to share maybe a success story that you've observed working with healthcare organizations. And could you share a little bit about what makes it successful?
Yeah, I know I mentioned our mobile food pharmacy previously, and so I think that the reason why this program has been really successful is it's an opportunity to be able to meet patients where they are. So, they know their clinics, they know their providers. The feedback that we've gotten from folks is that it really is a dignified experience that they have, and so there's an opportunity to reduce stigma related to getting food. They basically have been given a prescription of sorts or a voucher from their medical provider, be it a physician, medical assistant, nurse, community health worker. And so they love being able to come show that they have that voucher and then walk through and, like I said, have access to all this fresh produce. The organic garden produce, we pick it and basically it's on the truck within 24 hours. And so they have access to a lot of these foods that sometimes are difficult transportation wise for them to get to or cost wise. And then, like I said, I think the big key is that we have been very much involved with the healthcare organization itself. So they really show up and we work really closely with them to provide a really great experience for the patient. They're the ones talking to the patient about the program, scheduling the patients for an appointment. And so that's where the program is a little different than a mobile distribution. We have specific times that are not really announced to the public, but instead we rely on the clinic, on the community health workers to help schedule appointments for their patients. And so they're able to come and again, know that they're going to leave with a week's worth of groceries for their entire household. And so they really do that big lift. And so I think that that's one of the things that's made it really successful is the fact that they're also there in partnership with us. And what's helpful for them is they also, I think a lot in healthcare now, specifically related to social care, we talk about wanting that kind of closed loop. So I referred my patient, did they actually go and get the help that they needed? And because they're so involved, they're actually able to close that loop themselves. So they check their patients in when they come. They know that they came to get food. And we also have heard from feedback that patients feel more connected to their provider or clinic. So it's just been a really great experience. And again, we've heard really good things about how that program's working. We've heard great things from the patients, but also from our clinic partners as well.
What about you, Kim?
That's amazing. I love the work Bella's doing, and I always love hearing about it. In East Texas, as far as our partnerships with healthcare organizations, it's been amazing and it's always evolving. And so we started with our Partners in Health program, where we were able to accompany referrals for folks that screened high for non-medical drivers of health to other services like SNAP nutrition education, but also provide them food at the same time. And from that program, we saw that the folks that were completing the program were eating more servings of fruits and vegetables per week. We were providing about 30 to 40% supplementation to their normal grocery budget, which was a really cool thing in of itself, but then also able to know that what they're having was healthy. That was the beginning of the program, and that beginning of that program allowed us to connect with other healthcare organizations to grow our relationships even further and to be continually evolving that program. Kind of from that, we were able to form a stronger alliance with our medical school. So we have a medical school here in Tyler, we teach doctors. And from that, we were able to get our nutrition manager actually goes there and teaches a class to the med students about lifestyle medicine. So not just how to get the patients fresh fruit or fresh food, those sorts of things, but also working with the doctors as they come out on how to deal with these kinds of individuals or these kinds of homes or what kind of experiences these people are kind of going through. And so that's been a really great partnership to be in the front part of that education to those doctors. And then from that, we've also been able to invite that healthcare organization to bring nurses and students and clinics to come into our resource center. And so folks that are coming to get food from us, they can also get blood pressure checks. I've seen we've had diabetes classes and those sorts of things for the people that are coming to receive services of food from us, and also being able to connect that dot. And then that parlayed even into more, where we're now part of a community coalition with that healthcare organization that also serves the majority of our service area with clinics throughout that area. And so we're a player at the table for these conversations about what comes next. And from that, we've gotten to learn, we have cities and counties where there's not even a pharmacist, right? And so we have unique challenges. But because of this partnership that started with this health program, we are at the table to have the opportunity to contribute on a grander scale through all of that. So it's really been great, and it's constantly evolving and growing more and more. And we're looking for that to continue to happen.
That's awesome. And I love, Kim, all of the doors that opens with food. Like my boss often says, like, if you feed them, they will come. Or in a meeting that I've had with Nicole, I remember you saying food is the ticket to the dance, and I'm, one thing that when we talk about success, or like, what is it that we're really doing? I love to pick your brain, Nicole. When you partner with healthcare organizations, how do you measure success? Because food is such an expansive tool and resource. And curious about how your food bank thinks about measurement.
Yeah, and I will just say, as a registered dietitian, I'm always cognizant of that biomarker, but my role as a community-based leader is to make sure social needs are met so that people can actually benefit from the medical treatment that they're getting. And so I love a good A1C improvement. And I will say that food banks across this nation have shown that when you introduce a food prescription, a medically tailored intervention that is nutrition-based, you're going to see an improvement in A1C, right? That's why the doctors are prescribing not only medicine, but they're prescribing a healthy lifestyle. And so what I will say is really our food bank's role is to put our mission behind that of the healthcare entity. And when we think about outcomes that we want to celebrate and are happy to measure, we're thinking of things Kim just mentioned. We're thinking of food security improvement, right? How do we mitigate trade-offs? And so many people who we serve at our food banks, in fact, over 50% are making a decision between food and medicine. And so we're trying to mitigate those trade-offs. And so we're measuring the economic impact of our food distribution into that household, right? So that dollar value of food we're providing so that they can offset and pay for that medicine that they've been prescribed. As Bella mentioned earlier, we're looking at fruit and vegetable intake. We know the incidence of higher fruit, vegetable intake, reduce incidence of fruit and or sugary beverages or highly processed foods. If we can get half of that plate or more with fruits or vegetables through charitable food assistance, we know that their health outcome is going to improve. There's going to be weight loss, right? There's going to be improvement in A1C. So again, you'll hear from me as the registered dietitian talking about those biomarkers, but as a nonprofit leader, my role is to make sure those social factors are improved and really looking at the quality of life measurements that I just outlined for you.
Yeah, thank you. I love it. And I think that's one of the reasons why healthcare focusing on medical drivers, we think is just such a huge opportunity, this melding of mission and ultimately impact that clients experience at the end of the day, both short-term and long-term. Bella, I know that Central Texas Food Bank also does a lot of measurement and evaluation work. Would love the chance to hear about that work too.
Yeah, I very much appreciate what Nicole said too about kind of getting to more of the social issues that people, I think that's really what we're dedicated to as well. And I think one of the things I've noticed, there's already a lot of research that's been done on kind of food and the impact of providing food to people in a very formal way. So there's been a lot of capital R research. I'm a fan of lowercase r research and really doing more of that applied research. And so we've really spent time on trying to do program evaluation with surveys. So really understanding what is happening for the neighbor. I think, and so really what we've done, it's not super formal, but it's been very helpful, is providing kind of, surveys about, one, about how people feel about the program, but two, how they feel like they're doing in the program. And so, for example, with our home delivery program, we just asked people some questions about if they felt like their health was improving. And 75% of them said that, yes, they felt like their health was improved because of this program. And so that was really powerful. We're now doing some program evaluation out at the mobile pharmacy and looking at those data. The other thing I think that we're interested in addition to understanding how they feel about our program, is also helping the healthcare entity also understand how the patient is feeling about their program. And so we've been doing surveys and have found that about 70% of people who go to the mobile pharmacy feel more connected to their clinic. And so I think for us, the purpose of getting this kind of data is to get more funding for this kind of work. And so again, we know A1Cs are impacted, we know hypertension is impacted, but these kinds of questions about, again, connection to the community, connection to your provider, and about how do you just feel in general, I think can be really powerful. And so that's how we're looking at success. And patients have been kind of our next phase is to move into actually doing longer interviews with patients who many have agreed to speak with us in more detail about their experience. And then we are also working with a UT researcher on trying to understand the impact that the mobile pharmacy is having on stress and anxiety. Again, because so much of your health and your ability to take care of your health is impacted by that mental health. And so really trying to understand that connection as well. And so, yeah, I think for us, being able to tell a story through some of this data and really show, again, patients are feeling like this is a good program, allows us to, go out and try to expand the programming as well.
Thanks. This next question, I'll open it up to the group. I mean, all three of y'all have been in this space for a really long time, have seen this work, I would say, in different ways from the beginning, first starting with getting providers to recognize food insecurity, to understand what it means, what it looks like, how to screen for it. And now this era where like food as medicine is trending. And there are like lots of openings, especially in other states, around scaling this work. And so I'd like to ask the group, like, what do you see as the opportunities and future of the food as medicine approach in terms of food banks working with healthcare providers? And I would add plans as well.
I think, what we're seeing happening in food banks is this shift away from just a charitable response and kind of a downstream response to upstream. And so I think that being dedicated to these upstream interventions, we're here to help with both short-term food access, so getting the patient what they need today, but also working on helping in the long term. And so I know, Rachel, you mentioned SNAP enrollment. Most food banks here in Texas have team members who help with SNAP enrollment. And there's been studies to show that by getting someone enrolled in SNAP, it's actually a huge healthcare savings as well. And so we're here, I think, to work with health plans and health providers on both that short-term and long-term interventions. And, I think, again, people really forget about the scale at which we operate, which is why I appreciate you talking about the beginning. we're here to innovate and scale with healthcare. You know, we touch all counties in Texas. And so I think being able to have that footprint and work together, you know, I think what really is going to be important is being able to build capacity to do that work. So as there is more asked of us in this healthcare space and being able to provide data, closing the loops, letting people know about the interventions that we're able to help with, I think we need, you know, it's not free, so we need funding. We need those reimbursement opportunities to allow to build that capacity in those ways. And we're here, we want to do it. And so I'm excited about kind of seeing where all this goes in the next couple of years.
And I'll echo everything Bella said there. And I think kind of doubling down on, I think there's a lot of people, what people don't understand about food banks is really the breadth and the width of what we can do. You know, we're in 20,000 square miles, Texas, right? And we put out through our little bitty, you know, food bank in East Texas, almost 16 million pounds of just produce, which is 45% of our total output last year. And we did that through just our general channels. I think the other thing is that food banks have a proven track record of being able to take programs that are necessary, craft them, and roll them out in implementation. We've got a very strong nutrition education team. SNAP enrollment is very strong, and we've already substantiated that and been very successful there. So I think part of what the future of food as medicine is for food banks is it's just a stronger participation role. And like Bella said, that'll have to come with some measure of funding to support that work, just like the other programs that I mentioned that we've executed, that we've substantiated, executed on, and been highly successful on it. Those came from an infusion of funding to get those started. But food banks are highly sophisticated in what we do. We don't just act hither and thither and do things just because it feels good to do them. We typically have research and studies and plans in place before we move those forward. And so by being able to continue to grow our partnerships in the unique environments where our neighbors live, we're not only bringing them fresh produce or programs, but we're able to customize those based on place-based, right? Where do they live and what does it look like there? Because what I do in Tyler, Texas, where I'm based, I cannot do in Detroit, Texas, where they have a very small rural area with a very small community. That's going to look very different. And we have the sophistication and the ability and track record to be able to mold and change based on what we need to do and where we need to do it. And I think as far as moving forward, I don't think food banks are should they be involved? I think we're a necessary component of success in this area. And that's where, and I think we want to be a partner in that elevation. And that's kind of where I see us fitting.
Nicole, anything to add? Thanks. I love the your point around scale. Like, for example, 10 years ago, SNAP outreach, helping people apply for SNAP was something that was done in only one food bank at a very small scale. And 10 years later, $15 million later and 200 boots on the ground, we're reaching every county. So I appreciate you highlighting that ability to scale, especially as a network. But Nicole, anything else you would add in terms of opportunities or things to consider in this era of food as medicine?
Yeah. Many of us approach healthcare partnerships saying to the healthcare provider or plan, what's your sickest patient population group? And what are the outcomes you're looking to achieve? And then a food bank can sit next to you and say, and here's how we're either approximate to that patient group, able to scale a program to do it, as has been said, and to consistently execute. And so when I think of, some of the things that have been mentioned of being agile, I just want all of you on the call to really think about internally, we're trying to touch a certain specific population group that might have a lot of demographic uniqueness within it. And the food banks have just really outlined for you different strategies that were able to meet you where you are. And so the no wrong door, whether that's going through the emergency food network, right, as mentioned before, and then coming into the world of healthcare or vice versa. I think to really think of us as a partner that can really meet your organization where you are and evolve with you to do that. So I will just highlight that for the practitioners or provider and all the way up to the executive trying to make that decision on efficiency and cost effectiveness and quality care. Those are all things that have been mentioned, and we are ready and able to do that as a network of food banks.
Thank you, Nicole. And that makes me think of, in this era of food as medicine, there have also been some startup companies and for-profit companies getting into this space. And so I'd love to, maybe first for Nicole and then the rest of the group, if you want to chime in, what do you see as the unique role of food banks versus other options in the market? And, what do you hope in terms of the future of how this work evolves?
Yeah. So it is not unique for a food bank to be in a for-profit world. Food rescue, specifically ugly produce and all the things that you now hear about. When I started in food banking a decade ago, there was none of this. And so I will say there is a place for both. But the distinguishing factor, specifically when you think about an insured individual and an uninsured or underinsured individual in our state specifically, the food bank is really going to be the equity provider. We're going to be the person to say your uninsured, underinsured patient population that is going into your ER and costing your entity a lot of money. We have a proximity to them, right? Whether that's the faith-based place they're attending, the school that they're sending their children to, the senior center that they're sending their grandmother to. We're in partnership with them. We need to work with healthcare entities to make sure the funnels and the on-ramps for those patient populations are in concert with their healthcare. And so when you talk about place-based models that Bella talked about, that we have, that Kim talked about in the rural and urban settings, the difference between what CVS Health or something like that is going to provide is we're going to be targeting the people that don't make them a lot of money, but cost you a lot of money as a provider. And so when you think of the equity and health equity framework, the food bank is best positioned to work with a network of community-based partners that are place-based, that don't cost that neighbor a lot of money to get somewhere, that are proximate. And so, as someone who has health insurance, I pay a lot of money to make sure my insurance has something to provide me and my family if I need a nutrition-related services. But for those who don't have that privilege, that's where the food banks are positioned to kind of partner with that health entity to provide that same type of quality resource. I don't want to distinguish quality from a for-profit organization to a nonprofit. Our measurements are just as high, and in fact, maybe a little bit higher, just because we're going to put the neighbor in the center of our work. And so I will just say that when you're thinking about the patient populations, two things can be true, right? There must be a for-profit solution to work in concert with entities that have that bottom line. But for us, bottom line is neighbor wellness.
Thank you.
And I would say too, I think being place-based, we know our neighbors best, right? We know them very well. And I think the other thing that differentiates us is that we've been around for a long time. So we're not a startup. We've been around for decades and we're not going anywhere. And so we're a reliable entity that already is in all those places and knows the patient, the member. We know the neighbor. The other differentiator is that we also tend to provide services for the household. So we don't think about patients and members in terms of individuals. We think about helping the household. And I think that's really important in these healthcare settings, because if you're just providing an intervention to the individual, especially when it comes to food, if there are other individuals, especially children in a household, and you're trying to provide an intervention to a mother, that mother or parent is going to provide that food to their children. So we think about the household, and I think that that is something that really differentiates us as well. And so if the household is healthy, then the patient, then the member can be healthy as well.
Thank you. Thanks. And Charles, Jackie, I know we are at time before Q&A starts, so I will yield the rest of that time for y'all to moderate the questions.
All right, thank you. Thank you so much for that discussion. It raised a lot of interest and questions that in my mind, but I just want to give folks a chance to please raise your hand, and we can have you unmute and come on and ask whatever questions there are for the audience. And while we're waiting for folks to come up with their questions or formulate their ideas, I'll just ask a couple that I had jotted down. So Bella did a good job of talking about connecting evaluation with making the business case. And we always emphasize this in our discussions because I think a starting point for a lot of providers is evaluations to inform and drive quality operations, but taking it that next step then to, seek that funding and demonstrate, the return on investment. You talked about how food banks do have the capacity to scale, and what we need is the dollars to flow in to support that capacity. So as you've developed evaluations, and this can be for any of you, as you've developed evaluations, what have you seen funders most interested in understanding or learning about what works for food banks?
I think for us, I think what we've seen funders be really interested in, one, I think there's a renewed focus on mental health. I think we've seen that funders are interested in tackling that because there's been a lot of focus on physical health, on diabetes and other disease states, but not as much on mental health. And then I also think one of the things as well is this connection, having the neighbor feel more connected to their healthcare. So, because again, that provides value to the healthcare entity, be it a health plan, health system, healthcare organization. But if by providing food, the patient feels more engaged, right? They show up more, or they see their provider or their health insurance company as providing that intervention. I think that there is some interest as well in that piece and that tighter connection there. And again, we are happy to help kind of bridge that relationship.
And I'll echo Bella on that. I know we've seen a lot of that too, where as a physician, you see the patient and you know that one of the key components of what they need is just that food intervention. And Carla, you made a comment on the thread here too, is, it's hard to go to that next stage of treatment when that basic need is not necessarily being met. And so something we've seen is a lot of interest is that connectivity and that, okay, well, I gave you a prescription to go to your pharmacy to pick up X. I know you got it. You told me you completed that prescription. When it's a social determinant or it's a social thing, how do you prove out that that was taken care of in order to move on to the next stage of treatment there? And so I think that's something that we don't have a fully fledged answer on across our state, but we're all working collectively to try to get there to that, because we know kind of closing that loop and knowing that that intervention happened with food is just as important as knowing that that medicine got taken, and hence food as medicine.
Thank you. It reminds me of Rachel's comment earlier, that food is the ticket to the dance, and it opens up all these other services. I see a hand raised. Carter Kimball, do you want to unmute and pose your question?
Yeah, sure. Thank you, team, and good to see some of you. I know we've connected in the past. My question really is around the transition point that we find ourselves in, where the opportunities potentially, right, and being strategic about how to transition from maybe even exclusively grant or philanthropic into more of the like structural systemic engagement with healthcare, right? And in this instance, I'm thinking of partnerships with health plans, right, in particular, and actually coverage of certain benefits and things like that. And I'd love to hear about how food banks, like that level of sophistication. So, you know, HMA consults across the country with all sorts of different health-related social needs providers, and a lot of the hang up comes in that transition from I get a grant, I get to plan against it. And when the switch flips to, okay, I need you to report certain data elements, or I need for you to bill for something, the wheels just kind of fall off. So I'd love to hear a little bit about y'all's thoughts on that. And is there a kind of solution that's more low hanging than anticipated?
I'll start and my peers can keep me honest. So what I will say is, we're ready for the transition card. The hang up is, it quickly becomes a lawyer game, and food banks get out lawyered. And what I will say also is that everyone on this call has found solutions around that. And we just need to convey even better to providers and health plans that we've conquered the HIPAA argument. We've conquered the HIPAA certified servers. All of us on the call mentioned whether medically tailored meals or medically tailored groceries, and so we've done the IT deep dive. We specifically have data warehouses that house healthcare data and are talking across our state on how that would look to be a backbone for other food banks who need that capacity. And so our kind of better together mantra as a state association of food banks is quite literally in practice. The other thing that I will say is when you're talking to, you know, the leadership on the teams is to really think about the information we are providing you and less about the health information that you think you are really not providing us outside of maybe a diagnosis. And so the transition for us it's a lot easier for us to provide you information about redemption and utilization. And I will just say, we've participated in a study that reduced A1C significantly on the pace of medicine when people are redeeming at higher rates, right, on the food prescription programs. And so we are having this awkward conversations in silos as community-based organization healthcare. And the fact of the matter is we're both ready. It's just, are we going to make that leap? And so the wheels falling off is the nuance versus our ability to be able to capture data, report data back, report impact measures back, quality of life measures back, outside of us being looked at as that biomarker mover, right? We're going to do that, but we're going to let you all showcase that. And we're going to show you the value we can bring to that patient experience, as Bella said.
And I'll just plus everything Nicole said and kind of harken back to a comment or a question earlier about how are we like a for-profit? Well, let's not forget that we are a nonprofit. And when it comes to responding to grants and fulfilling on deliverables, that's our bread and butter as well. And so that's something we're really good at, is receiving dollars and fulfilling on the commitments of those dollars and reporting out that information. So it does really truly come down to all of the things that Nicole kind of said as far as the barrier goes. It's not a barrier based on ability. It's all the other nuances and rigmarole that gets in there.
Thank you for those responses. We still have time for questions. One I don't want us to miss out on that we had from earlier discussion is from the panel members, what can participants on the call today do right now if they want to approach a food bank and start talking about partnerships?
Yeah, I'll answer on that. And so just get to know your local food bank, right? If you don't know who it is, Rachel here is a great resource, as Nicole talked about. And as Rachel kind of touted early on, Feeding Texas connects us all across the state. So no matter where you're joining us from today, there is a food bank that serves your area and that would love to have you come take a tour or come get to know them or connect with somebody at that food bank that's doing programming. Most all of us do mobile food distribution or some measure of food distribution, and we need volunteers all the time, and would love to have you guys come out and do that. As Rachel mentioned, and Bella mentioned as well, we've got SNAP navigators across the network, and those SNAP navigators are always looking for new locations to come out and set up and offer that service. So if you've got a clinic or if you've got an opportunity that where patients are being seen, that's also an opportunity for us to have a SNAP navigator come out and recruit for that benefit. And so all of those sorts of things are super important. Legislative agendas, you guys are great spokespersons when it comes for helping us move these needles forward in regards to food as medicine, and we really need your voices just as much as we need our voices at the Capitol. But really, there's just numerous ways that you can get involved, but it really starts with getting to know who your food bank is in your local area, and I guarantee you they all want to know you.
Thank you. I see a hand raised from Robin Humphreys. Robin, do you want to unmute and ask your question?
Sure, thank you. Real quickly, I'm with Baylor Scott and White, and we started a program out in our San Saba area, and we actually met with the food pharmacy trailer back in November and December, and we had some talks going, and then the person that we were working with, I'm not sure if she was reassigned or something, but anyway, we lost contact and we struggled for a little while just to get something done. We ended up doing just food boxes, but we really want to get that increased. We'd really love to have the food pharmacy trailer back out there if possible. Bella, would you be the best person to contact, or who can I touch base with to really get this going again?
Yes, you are welcome to contact me. I can throw my email in the chat. And I think I second what Kim said. Like, we love to give tours. We, love to have you all come out. So please contact us if you're interested in learning more.
The other thing that I will just say is our websites are pretty cool across the state. And so even if you just put in a search, healthcare programs or nutrition programs or food RX programs, all of our websites are going to pop up something for you if you can't reach a specific staff member. We are all connected to 211 across the state. And so just yesterday, a 211 operator transferred somebody to me who was asking specifically about something. So that's what I will also say, just easy, accessible ways to get to your local food bank. There is someone at every food bank that's working in a community facing role. We may have some opportunities with staffing because we're small but mighty agencies compared to healthcare institutions. But please, even if you go to feedingamerica.org and put in your zip code, you're going to find the local food bank associated with you. And Google is getting better. So just some easy ways to remember on how to connect with your local food bank.
Well, I appreciate that discussion and for just the storytelling from each of you from your own experience. We really are lucky as a state to have such a strong network here. I'm going to turn our discussion over to Jackie to close us out.
Thank you, Charles, and thank you, Rachel, Nicole, Bella, and Kim for sharing all these great insights with us today. These types of convenings are critical to advance NMDOH work in Texas. And as you know, we all love to get together for our virtual convenings, but I want to announce that we have opened registration for our 2024 annual conference this year, which we've expanded to a 2-day conference to enable more opportunities for networking and discussions like this one. The conference will take place on December 5th and 6th in Houston, Texas. So please check out our website. I'll put the link in the chat. Oh, Charles put the link in the chat to check out the website to secure that early bird pricing. I also want to direct everyone to our consortium's program index. This is a catalog of the NMDOH programs across the state that are sponsored by health system organizations like plans, providers, and hospital systems. We have many food as medicine programs that are facilitated through partnerships with food banks. This is a single repository of NMDOH programs that features abstracts with searchable fields. But this index, again, will only be as robust as we make it. So I'd like to invite you all to contribute to this effort by connecting with myself to add an abstract for the NMDOH work you're doing at your site. The link for the program index is in the chat. Please bookmark it to take a look, and when you have time, to submit your information. Thank you all for this robust conversation today. We are grateful for your input, and you will receive a short survey over the next couple of days, as well as the recording and presentation slides. This consortium is what we make of it, so we're looking forward to hearing from you what you want to hear from us so that we can deliver it. Please stay in touch. Thanks again, and have a great rest of your day.